You're listening to Holy Health, the podcast that brings you the latest in health ideas and technology across the spectrum of fields. While ultimately our fate is up to God, how we get there is determined by us. As it says in Kohelet, there is nothing new under the sun. We get that everything can be found in Torah. Our goal is to empower you with knowledge that may help you make better lifestyle choices. This podcast has been brought to you by Musach Haguf Physical Therapy and Personal Training Studio. Our motto is fixing the past in order to build the future. You can find us on Instagram at Musach Haguf. Hey guys, welcome back to the fourth consecutive episode for the first time in well over a year of the Holy Health Podcast. I'm really excited to be bringing you guys these episodes weekly again. It's something that up until October 7th of 2023, we were pretty consistent in doing, and we hope to continue that. Though we will be taking a break next Thursday for Hanukkah. So I want to take this opportunity to wish everybody a Hanukkah Sameach, a happy Hanukkah as well. So this episode with Dr. Joel Gross on stem cell therapy is something that has interested me for a very long time. I started hearing about it many years ago. I think I've been a physical therapist for, I'm going to say 18 years because my daughter just turned 18 and I graduated a few months before she was born. So they were talking about this sort of in the theoretical way. And I think maybe there had been different trials of stem cells in different places in Europe and things like that. And it really wasn't something that could be done in the US. So I heard Dr. Gross, I don't remember where, I don't remember on whose podcast, but I heard him a while ago on someone else's podcast, and I immediately felt drawn to wanting to interview him because this like stem cell just have a potential to help so many people with so many different things. You'll hear the explanation of what a stem cell is for those of you that don't know, but it's a really, really interesting topic. And joining me for the extra is one of my favorite people, Rabbi Peretz Segal. You guys have heard him on several episodes before. He always makes interesting connections, and this time is no different. So I'm excited for you guys to hear what he has to say as well. And not much else, to bring up right now, but I will say that if there's anybody out there looking for a great cause to donate for, I have a couple of soldiers that I am treating, one who was injured in Lebanon, one who was just injured in his over a year of service. I think his unit has been in consecutively pretty much since October 7th. And, they can't afford to pay, private PT prices, which I understand. And I wish I could afford to treat every single person for free, but unfortunately I can't. So if anybody is looking for a very worthy cause to donate to, I know it is great. Our soldiers need equipment. The Army should provide equipment. And I guess it doesn't supply enough of it. And the same thing goes for physical therapy. Often the physical therapy that the soldiers are getting just isn't adequate. People do come privately when, through the socialized medicine system, you're not getting what you really need. So if there's anybody willing to donate a treatment or two to a soldier, please get in touch with me privately. My links are in the show notes. I really appreciate it. And we are in Kislev, right? The month of miracles and getting ready to go into the holiday of miracles, Hanukkah next week. And I just hope that we will soon see a miracle and all of our hostages will be returned home safely, that our soldiers will come home safely, and that there will be a swift end and peace to this region. That would be a really, really nice miracle, lasting peace to this region. And with that, I want to wish you guys a Shabbat Shalom. Hello, everyone, and welcome to Holy Health. My guest today is Dr. Jeffrey Gross. Dr. Gross is a board-certified and fellowship-trained neurosurgeon and the owner of Spine and a regenerative medicine practice called Recelebrate. He sees patients in Orange County, California, and in Henderson, Nevada as well, also remotely by computer video conference. In his practice, he offers specialized precision and concierge treatment options for patients with neck and or back problems, as well as brain and head injuries.
He provides a comprehensive approach to evaluating the pain generators of the spine and associated areas and digs deeper to find the source of the problem when identifying the root issues of persistent pain and injuries. Dr. Gross employs regenerative medicine and other non surgical options first and foremost. He's an internationally recognized expert in these fields. Dr. Gross graduated in 1992 from George Washington University School of Medicine and Health Sciences, and he went on to complete his internship and residency in neurosurgery at the University of California in Irvine in 1997. He completed his fellowship in spinal biomechanics and his chief residency in neurological surgery at the University of New Mexico in 1999. He's a medical philanthropist and a perennial champion of patient needs over health insurance hassles and denials. So, first of all, thank you so much for being here. I really appreciate it.
Thank you for having me. It's a pleasure to be here.
Okay. So, first of all, you really moved around a lot, by the way. Were you married then? Like, was your wife okay with that? I don't know if you were married then or not, but there's a lot of moving around you did.
You have to go where the best training is and the best mentors are. And I didn't think it was that much for someone with a long residency and training. But yeah, I mean, when I had a family and young children and what have you, they came with.
Well, so my dad, I think, moved once and then got drafted because he's much older than you. So then he got drafted to the Navy. So then we just moved with him to Georgia, and that's where we ended up staying. So my dad's doctor also. So anyway, so we're here today to talk about stem cell therapy, stem cells, and I find this to be such a fascinating topic. Could you just tell us just sort of a brief definition about what a stem cell is and what it can be used for?
Sure. I mean, this is not new, but there's been a resurgence lately of the science is catching up with the natural magic, and a stem cell is basically a cell that has more potency to be able to divide into different types of cells, generally speaking, and we are made of stem cells. The embryo is all stem cells, for example. The fetus is massively made of stem cells. And then as we grow and heal, we tap into our stem cells. And even as adults, we call for stem cells to make new blood, to make new skin, to make things that we need when we call upon them. What we're tapping into better than ever now is being able to use that knowledge and leverage to enhance a declining ability to tap into our stem cells as we age.
Okay, that's great. So,
Hmm.
I was actually under the impression, I mean, and again, I've been out of the United States for a while. I'm a physical therapist, but I remember years ago hearing about like, stem cell therapy, using it, let's say for arthritis in knees and things like that. But I was under the impression that it was illegal in the United States. I mean, maybe that's
Yeah,
changed.
a lot of people are under that impression, but when properly sourced and applied, they're not illegal. What the issue is there's what we can say and not say by virtue of what's considered approved for claims by the FDA. That doesn't mean it's illegal, and there's a large myth surrounding that.
Oh, okay, fine. So tell me a little bit about what you're using it for. What are the main things you're using it for in your practice?
So we apply regenerative biologics first. Well, first and foremost, I'm a spine doctor for over 25 years, and I got into regenerative medicine because I needed to tap into the latest tools for spine because the spine field hasn't progressed significantly in decades. I wanted to go back and learn that. My patients encouraged me actually to help them avoid surgery, which we've been, happy to have some success with. So I tap back into use it for the spine, but that has blossomed into uses in other joints, probably more so than the spine, and also for other age related processes, including inflammatory based disease processes. We use regenerative biologics to help people heal themselves. And now there's a whole group of people that we call biohackers or anti-aging enthusiasts, and I'm one of them now. And we use things like that to try to foster that process biologically.
Okay, so you're saying that, let's just say a regular person that has no pain. And then I'll talk about if there's a use in beauty and anti-aging face things. I'll leave that for later.
Right.
But if you're like, let's say, a biohacker, where would you be getting the stem cells?
Well, me personally, or generally speaking, we could talk to both.
Can we do both? You personally,
Of course.
and where they may come,
So let's do it the other way. Generally speaking, sources of regenerative biologics in the world would be your own body. You can harvest stem cells from your own body. And the typical sources would be your bone marrow, which requires a bone biopsy of sorts, and or the fat, although I'm not a huge fan of fat. And there are good results with fat depending on the use, but too much fat in your body is an inflamed tissue. And I don't want to use stem cells that have been overexposed to inflammatory messages. So there's your own source. You can also use perinatal source, which is basically afterbirth, placenta, umbilical cord, amniotic fluid contents, things like this. Once the mother has delivered her baby, usually by C-section, and instead of throwing away all these components, they are kept and tested and screened and then made available for our use. And so what do I use? I personally like the perinatal source stuff for a few reasons. Number one, it's the most bioactive. It's, if you take your own biology, and if you're older like me, I'm pushing 60, I have cells, even my own stem cells aren't as active as they once were. They've been exposed to the environment, to the air, to the water, what's in our food source, etc. They are not as active. When you take your vehicle to have the oil changed, you don't put the old oil back in it. So I'm a believer, if you want the best stuff, you go with the least exposed material, and that comes from this perinatal source. Plus, it's a lot easier. You don't have to have a bone marrow biopsy or your a mini liposuction to take all the fat out.
So is there no problem? I mean, this is kind of a twofold question, because I do remember it was a very common thing, even when I was having kids. Number one, to save cord blood in case you would ever need those stem cells. But
Right.
Number two, is there any issue of like your body rejecting them because it's not yours, like it's
Right.
coming from somebody else?
Yeah, I'll happily address both. So umbilical cord saving is sort of an early tapping into the stem cell market and realm. And it's the only FDA approved claim one can make, is that you can put that away, and then God forbid your child has leukemia and they need to have their bone marrow wiped out with chemotherapy, you can replace it. They have their own marrow. Now, you asked about match, because of course people who need bone marrow transplants have to be matched, which is interesting, because if you save the umbilical cord cells, you don't have to match because it's your own, So it's interesting because commonly stem cells and stem cell derived biologics, because stem cells aren't the every aspect of regenerative medicine, typically don't initiate an immune response, meaning they're very difficult to reject because they temper the immune system. We call that immunomodulatory. They don't show themselves as foreign, even if they come from someone else. So I have not heard of or seen a reaction to a stem cell type treatment. That doesn't mean it's not impossible. And then one has to ask the question, well, why are we so busy matching all these donors for a bone marrow transplant? And I actually I don't know. I think it's out of the significant rejection that happens with organ transplant. But organs aren't stem cells, so those differentiated cells that are very specific, make more surface markers to identify themselves like a serial number. And that's why you have to match an organ donor. And we're probably being a little over the top when we try to match the bone marrow donors.
Wow, that's a little scary because it's almost like, there are people that have literally died because they couldn't get a match, but you're saying that maybe we could have just used almost anybody's stem cells. So that's a little.
I'm not an expert in the field of
Okay.
complete bone marrow transplant, but I can tell you that when we do stem cell or stem cell based approaches for people, we never have to match. We've never seen a reaction of any type of rejection. And in fact, the immune system is perhaps enhanced by that approach, not initiated.
Okay, wow, that's really interesting. So back 1 second to like the using the afterbirth and that. Does the mother need to give consent that you can take her placenta? Only because I'm thinking like DNA and like, I don't know.
Yes, I mean anything should happen with permission, both on the donation end, of course, and the receiving end. Um, that's just ethical and proper.
Okay, fine. Now back to these biohackers. They come in for stem cell transplants, and where are you putting them? Like, where are you injecting them?
So, we biohackers, anti-aging
Exactly.
enthusiasts,
Yes.
um, we tend to do it IV for preventative purposes. So that way your body gets a little bit everywhere. And otherwise, we are usually dealing with a specific issue, like knee osteoarthritis or spinal issues or progressive kidney failure, something like that.
Okay, now can you tell me a little bit about what you've seen? Like that's interesting. Progressive kidney failure is not something I would have ever put together. So how does that work? Someone like in
Well, it works like this. As we age, we tend towards age-related diseases. The vast majority of those have a component of what we call chronic inflammation. And chronic inflammation is our cells are fighting the environment. They're defending themselves against the environment by releasing uh, uh, small molecules that they make. So they're programmed. Their programming is tied into making proteins that call for the immune system, and this can smolder and go on and develop degeneration of tissues. So osteoarthritis, for example, or chronic kidney disease, type 2 diabetes, Alzheimer's disease, coronary artery disease. I could go on. I mean, all of these have an inflammatory component, and they're called the diseases of age. Now, aging itself is really accumulating this chronic inflammatory change. So the faster you age, the more that chronic inflammatory markers you have, and vice versa. The more of those markers you have, the faster you're aging. So, if we could drink, perfectly clean water and have a perfectly clean diet from the day we're born and never get exposed to any bad air or any environmental stresses, we probably do, quite well. Live, age slowly and push off those diseases. So because our world is full of who knows what, we we struggle to do that. In fact, we work hard to eat healthy and take our supplements and be physically fit and do all these things. So we're really working against inflammation that's accumulating. So anything that has this inflammatory component can be slowed and or even possibly reversed by these very powerful anti-inflammatory regenerative medicine approaches like stem cells or stem cell derived signaling particles that we call exosomes.
Okay, so how often would somebody need to come? I'm going to separate the people who are coming from the knees and the back and that for a minute from the biohackers because I'm finding this fascinating. How often would they need to get a stem cell? Do you call it a transplant, like a stem cell
Uh,
infusion?
Yeah, we do an infusion. It is a transplant of sorts, but that's kind of a little overkill since it really isn't so drastic. But I mean, it just depends on the individual, right? If it's someone young that wants to start early, like younger people start Botox and things like that earlier just to prevent the wrinkles from happening. So you probably wouldn't have to do it so often, maybe every 6 or 12 months. Um, those in the middle ages, maybe with a little aches and pains and energy loss and that kind of thing. We like to do 3 to 4 times a year and so forth. But we give one and we see what the result is. And if someone has 5 great months, then maybe they don't need to do it again. A lot of people fly into we do this in our clinic in Las Vegas, Nevada, and this is where people like to fly in, and we do it also based on their travels and their lifestyle. So it's precise for each individual. There's no one recipe that we force people to follow.
And are the people who are doing this, or are some people doing it and not changing their diet and not exercising, and they're just taking this like as if it's the magic pill? Or is everybody who's doing this, they're all
No,
in?
I sort of won't let them. I let them know, hey, listen, if you're going to be spending this money and you're this invested in your health, longevity, your health span, we really want your body and your biological environment to be most receptive. So I usually start with people remotely on Zoom, just like this, and we start with their exercise, their diet, their supplementation, their sleep, their hormonal status, their breathing, mindfulness, everything. We help them optimize. Now, most biohackers are already there. But a lot of people who are interested in this or say, hey, you know what, I'm 65 years old and hey, I've got grandkids and I want to be around for a while and are just starting their anti-aging journey. We optimize them first so that when we do a regenerative medicine approach, they can get the most out of it.
Okay, listen, it's so interesting because I wasn't even expecting this side of it. Like I was thinking, oh, we're going to hear about how it helps knees and backs and more of that.
Yeah.
So when it comes to somebody coming, let's say for their knee, right? How long does it take for them to feel a difference? Like let's just say somebody has knee osteoarthritis and they want to avoid a knee replacement.
And that's my perfect, patient is that person who doesn't want the surgery. And it really depends on how bad it looks on the MRI beforehand, how bad the pain and dysfunction are. We've taken people who are in their upper 70s with significant disability in walking, stiff to get up out of a chair, slow to get around, not going outside for walks, and allowed them to improve in about 4 months to where they could start dancing lessons again. So now that's not everyone's going to be the same, of course, that's not for sure, but it just depends. There is an initial benefit in pain because the biologics are so heavily anti-inflammatory, and some pain is from the inflammatory component. And when I speak to inflammation, I'm speaking to the biochemical ongoings in the cell and around the cell and in the body. And then as the anti-inflammatory activity and messagings to those cells that maintain and produce the cartilage proteins in the knee, for example, switch their programming from pro-inflammatory to chronic inflammation programming to the opposite, to anti-inflammatory programming, optimal operation mode. They're not inflamed. They're not releasing those biochemicals of inflammation. They're not calling for the immune system. They're busy making what they're designed to make, which is, cartilage proteins that created that knee in the first place when it was in the womb. So we're tapping back into the factory settings, right? We're going back to the original biology.
I love that. That's great, right? Restoring the original settings. I love that. Yeah. So do you recommend that people have physical therapy and like how many stem cell injections would they need? And do you recommend that they have physical therapy to change the way they're loading the knee?
Yeah. So what we do is, I'm going to try to answer all of that.
Sure.
What we do is we do an MRI, but we do a very special MRI to get some additional sequences to look at the bone marrow, because the biological activity is in the edge of the joint in the bone marrow, and most of our stem cells are in the bone marrow. The bone marrow made that joint in the first place. Okay. So with that MRI, we target how many spots we want to hit and exactly where to go for the optimal benefit in the what's called the subchondral bone. And this is well proven in literature that has over 15-year follow-up. And I think that was published in 2021. So we're hopefully getting to the 20-year follow-up soon. And this is in Europe. Of course, the United States has suppressed most of this. I don't know about all the other places in the world. I know Asia and Europe are way ahead. And so this isn't just an idea. This is demonstrated. And then we inject, and we hope that it's a one and done. And we monitor those people. And I have yet to have someone sign up for a second one because our results are, luckily quite good. Now, will there be someone that the injection, we deliver the injection, it does some work, but maybe it only helps them 50%, and after it's sort of phasing out and they've gotten their maximal benefit, they're like, hey, I'd like to get another round of that and see if I can get a booster and get more. Yeah, there's going to be that person, of course. That's not the goal. The goal is to do this once and do it right. Or is there someone who, we do this and they have 10 great years, and then the usual wear and tear on the knee or something, causes them to need another one. That's going to happen. As to the physical therapy question, there's no downtime from this. I want people to use that joint normally, and that may require some re-education on loading and things, and reactivating certain muscle groups around the joint. Because we want the mechanoreceptors in the knee to be maximally stimulated, because those mechanoreceptors allow certain cytokines, little cell-to-cell communicating molecules, to be released, saying, hey, this is a weak point. Let's bring some of that regenerative medicine over in this area. This is where I need it most. So I do appreciate people who can have a good physiotherapy program to really get the most out of that before, during, and after these types of rehabilitations.
Oh, okay. That makes sense. So most of the people, though, coming into you, let's say for their knee, are they also then saying, I want that full body, like load me up with the IV as well? Because
some we can do both at the same time. And sometimes we have people come in, they have maybe a history of osteoarthritis, they have aches and pains everywhere. And then we said, let's start with an IV. Let's see what we can help curtail. And then if they come back and say, yeah, everything's better, except my ankle, then we can address the ankle more focally.
Right. Okay, so let me ask you this. What about for beauty, for getting rid of wrinkles? Does it work for any of that stuff? So can you inject it in the face?
We do inject it in the face. We have a nurse practitioner who we work together on the cosmetic side of things. And we have two procedures in that realm at this time. One is microinjection of exosomes. So in the cosmetic world, there are lots of exosome offerings. If you Google, improved skin and exosomes, you'll find tons of clinics that say, yes, we use exosomes. But let me be super clear. Exosomes are cell-to-cell signaling molecules, and they can be derived from stem cells. And I'm a big fan of exosomes because I think they have some significant advantages in many areas over stem cells. Be that as it may, exosomes and stem cells do not penetrate the skin. So there's a bit of a myth out there. So you need to actually get them under the epidermis layer of the skin, which is the barrier in the skin, to the cells in the dermis. So to do that, you have to either microneedle and make little holes, let them seep in, put it on top, let it seep in, or even better, microinjectment, which is basically like a microneedle injection. And that's what we do. We have a microneedle injection device that we have, and it's allows us to deliver, high quality exosomes. Also, you have to be very careful. Just the word exosomes is not adequate. If you get a typical dose of exosomes in our clinic is about 520 billion particles. Now that sounds like a lot, but they're measured in nanometers. They're nanoparticles. They're super small. They're about 1/1000th the size of a cell. Okay, so the if you go to a cosmetic clinic, you might get 5 or 10 million. So in any event, do some reading, know what you're getting there. The second cosmetic procedure we have is actually for thinning hair. You have to have follicles. We can't make a bald man return to his youth, but for thinning hair for men and women, we do inject the scalp. I've had that personally 4 times over the last year and a half because I've started to get some thinning, and hopefully you can see I've got some pretty decent hair. Yeah, it's not exactly like it was when I was 18, but it's
pretty good.
Okay.
Oh, okay. Wow. Do you have like before and after pictures on your website? Obviously, we're going to link that as well.
I don't on my website. I do have them on my phone, and we've been meaning to make some social media posts from them, but it's a good idea. I will do that.
Yeah, because that's something that like so many people struggle with, men, women, thinning hair. That's really like a big deal. That's actually really fascinating. How long does it take for you to see growth after the injections?
It does take a few months. The follicles are pretty deep, and the hair has to, make its way to the surface. So we're reinvigorating those follicle cells and their biology, and we're trying to save the ones that haven't died. They're just getting ready to.
Okay, it sounds painful though. Just out of curiosity, is that painful?
Well, we put a
You can be honest.
Well, I'll tell you, I will be honest. We put a topical numbing cream for about 30 minutes on the scalp, and then we do a couple first injections. And those couple first injections, you feel a little bit, but I've done it 4 times. Haven't cried yet. And then once those first injections are in, then it's even more numb because the injections have a numbing agent also. And then we go back and fill in with a bunch more injections. Then you can't even feel it.
Okay, wow. Okay, so there's just really, it's unbelievable the amount of uses, beyond, I guess it makes sense because stem cells are supposed to be able to generate into anything, if I remember my early biology correctly. So it really does make a lot of sense. If somebody was taking that IV, would they see a change in hair? Like maybe not as much as if you injected it, but would they overall maybe see a change in hair growth? And
Listen, we've seen a large variety of responses from the IVs. And if you allow, I'll make a quick bullet point list here. We've seen a man pushing 80s get the IV. And he did it for energy and cognition and other things, but his gray hair started to turn black again at the root. So I can't say he had more growth or not, but he already had a good head of hair. It just started to, behave more youthfully. We've seen improved energy, which is very common. We've seen improved recovery from workouts, which means you could probably do more at your workout and get more out of it. I had one person, I spoke to a week after the infusion. He's a young, healthy, very active athlete. And he said, I really didn't feel anything. But then a day or 2 later, he sent me a snapshot of his HRV. And HRV, for those who don't know, stands for heart rate variability. It is a very sensitive health metric that you can measure on if you have a Whoop band, an Oura ring, or an Apple Watch now will do it. And you have to go into your health settings in your iPhone and find HRV. And HRV is very sensitive. If you don't sleep right, if you have a little cold brewing, if you've had too much to drink one night, it'll show. And it speaks to recovery and strain of your body's systems, generally speaking. and he showed his HRV, which was running in the 60s, which is phenomenal as it is, jumped to the 90s. So we also have other blood health metrics we look at. There are some biological age tests, markers both inside of the cell and outside of the cell that tell us how much inflammation is going on in the body. Not just a blood test, but a regular doctor wouldn't necessarily know how to order these. But these are, how fast are you aging? How inflamed is your body? And how do your cells show that? And we've actually shown improvement in those tests after repeated infusions. So those are the kind of things we see. We also see improved cognition, improved libido, a bunch of individual things. Aches and pains tend to diminish, and people come in and say, I didn't even notice I had that ache, but now that it's better, I guess I was just used to it. It's gone. We have people with different types of problems like neuropathic pain or neuropathy that sometimes can have improvements. It's across the board. We also have a group of people who have trouble with lung function, trouble breathing, maybe chronic bronchitis or leftover problems from COVID or vaccines and things. And we can do breathing treatments with these small particles.
That's exactly what I was going to ask. Would people be coming, like, let's say, long haul COVID, post COVID, things like that? Okay, so you've seen success with that as well.
We have, and with the cognitive part too. Not only with the long COVIDs, the foggy head, we see that also in the traumatic brain injury group, because there is an inflammatory component to healing. Part of healing is chronic inflammation, and we want to slow and stop that, and even hopefully reverse chronic inflammatory processes, because that's what's aging us. That's what's degenerating us. So we want to flip from degenerating to regenerating.
Okay, I mean, every step of what you're saying, I'm like thinking of this person. I'm like, oh my gosh, this would be good for this person. This would be good for this person. So brain injury, right? Traumatic brain injury, TBI. So first of all, are you giving them like the IV, or are you injecting it near the brain, or are you?
No, we try not to inject in the brain. Luckily, one of the benefits of the exosomes over stem cells, we try not to poke you in the brain. But one of the benefits of exosomes are they're so small, they will cross the blood-brain barrier. Stem cells do not, by the way. To get stem cells into the neurological system, you have to inject them into like a lumbar puncture to get them into the spinal fluid. So it's a lot easier just to do the exosomes. They travel further, they penetrate tissue better. There's also a nasal spray delivery, which is good for the brain. So that's an option as well. I tend towards the IV because then the whole body can get it.
It sounds fascinating. So again, for like TBI, are you also doing like one treatment, seeing how it goes, and maybe they're coming again? Or, and have you seen results if it's, let's say, like a 10-year-old injury?
So I haven't done that on a lot of, we'll call it, long-standing injuries, because I think what you're asking is, hey, these people have had 10 years of chronic inflammation. Can you reverse that, at all with one? And I'm going to think the closer you do it to the time of the injury, the quicker you stop and reverse that inflammatory process. So I haven't done that. Most of the people we see are within a year or so. So I would say the earlier the better in most things.
Okay, so do you think there would be benefit? Because I did a podcast about 6 weeks ago with somebody who's very big in the hyperbaric oxygen world, and and this was right after I heard about this particular case. I had asked him about this injury, but let's say somebody was tourniqueted one of their limbs for way longer than it should have been tourniqueted due to a variety of reasons, where they've lost feeling in that limb now. Do you think stem cells, I'm asking you, like, this is probably not something you've ever dealt with. I'm just asking you theoretically, do you think this is something that could help?
Potentially. If, just the feeling component means there's something, a nerve was injured, right? So we have to have to know that nerve cells heal from the spinal cord out for sensation. So that spinal cord is okay because the tourniquet wasn't there. So theoretically, we could get some help there. If there is scar tissue or a block around that nerve, then we may have trouble getting past that, any recovery getting past that, which allows me to reference a very interesting study that was done in China not too long ago, where they took spinal cord injury victims, and I have some spinal cord injury people too, and we treat their neuropathic pain, and we treat other, types of myoclonic jerking and things but we haven't had anyone walk again. But in the China group recently, they've actually done a surgery, gone into the spinal cord and removed the scar tissue that was acting as a block. Now, they didn't describe in the paper exactly what they did, but they removed the scar tissue, applied some type of regenerative biologic, I don't know if it was stem cells or what have you, I don't recall, and had some improvement with nerve fiber passing through that area that used to be blocked by scar tissue. So there's this concept that the injury walls off and tries to heal with scar tissue, and that blocks the fibers from getting back through. So in that example of the tourniqueted arm, we'd have to know if that nerve tissue has blockage, and the way to do that would be to do, there's electrical nerve testing. You can see if there's a delay or a drop out there. There's also, if that person has atrophy because the motor nerves were affected, we do have some instances where we've injected muscle and help people redevelop an atrophic, meaning that muscle is wasted away, to help them regain that,
Okay, so something you said was really interesting to me, right? Because you talked about scar tissue. And again, this is like totally theoretical. Someone gets into a car accident, God forbid, today, and like fresh spinal cord injury. I'm wondering what would happen if you injected stem cells now, right before they're scarring.
I agree. I think someone like that would be a great study, and it's probably here in the U.S. It probably won't happen anytime soon, but it will be done. And I think that is probably the way to approach these things, is the earlier the better. Yeah.
No, that just, because everything you're saying, it just sort of, that seems like it would be the logical progression, and it makes a lot of sense. So basically you're basically saying though that everything you're doing that you can do in your office really is FDA approved. Like, meaning I don't even want to say FDA, but meaning it is okay for people to do. Sorry, I don't want to use that word, but meaning whatever the word is, people are allowed to come to you and pay privately to get stem cell injections for whatever.
Yeah. We have a doctor-patient relationship, and kind of like church and state, the government should stay out of that relationship. The FDA approves claims, and there have been no approved claims for stem cells or exosomes to treat or cure a disease or condition. They also haven't unapproved them. So it's neutral. And by the way, it's just claims. So we are very clear that we cannot promise anything. We don't make any claims that we're fixing something. Even though I can show you examples of things and we can try things. We're very clear and as compliant as absolutely possible in that area. And it's just about, it's sort of they tell us what we can and can't say based upon their policies and probably all kinds of influences around those.
Okay, that makes sense. Now, am I allowed to ask you at all about price, or is that, I'm just curious to know, or even random, like range?
Yeah, it's your show. You can ask me anything you want. Listen, I'm happy to talk price. We've got the exosome IV infusion priced very low because I want to, help people and make ourselves available. So coming in the office, once you're optimized, ready to receive them, we have that under 4,000 US for the 520 billion exosomes. We can do cells. I've done cells. I can tell you personally, when I do IV cells on myself, stem cells versus exosomes, except for the first 2 weeks, the effect was similar.
Mhm.
The first 2 weeks, the problem with stem cells are not only do they not penetrate as far into the body, but they only last about 10 to 14 days.
Mm.
And most of them get absorbed by the heart and lungs, which is great for the heart and lungs. But the rest of the body can't get them because they're just big and sticky, and that's where they go. So the first 2 weeks, my heart was just on rocket fuel, and you'd lie down in bed and go to sleep and just be pounding, you know. But if you're recovering from a heart attack or bad lung problems, it might be the way to go. And we've done that. We can do that too. Stem cells are about twice the price.
Oh,
Another
okay.
benefit of exosomes are they're half the price.
Mhm.
So we've got exosomes under 4,000. A knee depends on, let's say, a joint or a knee depends on the number of doses because we have to purchase those doses. And we also do that at a surgery center under local and light sedation twilight. So
Mhm.
we have to pay for that. So a knee, a single dose knee is under 10,000. 2 doses, it's, uh, probably closer to 15,000. Depends exactly what we're doing on that and where we're doing it. We've had people come in and do 3 different joints, and the more we do at the same time, the better we can package the pricing.
Okay. Listen, it makes a lot of sense. And again, this really opened my eyes to a lot of things that I didn't think were possible or I don't want to say approved, but that I didn't think were able to be done. I really do believe and understand because it is one of the things they teach you. I went to PT school and even just in biology and anatomy that stem cells can differentiate into anything. So
Yeah,
it makes complete sense what you're saying. And I'm really happy to hear that this is something that people can have access to. You know what I mean? Because there are many things, there are people that I've interviewed that have amazing treatments. I interviewed Dr. Sabine Hazen on fecal transplant. Well, that's only approved for people with C. diff, but there's a lot of people with a lot of, gut issues that could really benefit, but
right.
you can't
100%.
go in and get it. So knowing
Uh,
that this is something people can have access to is fantastic.
yeah, a lot of what doctors do isn't approved for claims by the FDA. There's this myth that they control, medicine. Well, they sure try, but that's not how it works.
It's good to hear, because people, I went to a PT program that was very research based and it was, you were only supposed to do things that were proven by research. And I'm like, okay, you people can wait for the research. If you're waiting for the research, you're 10 years behind me because there's so many good things that are not going to hurt somebody that can help. And I was all about like, shouldn't we be helping people, like
Right.
if it's going to help and it can't harm them, do no harm is,
Right.
a very different thing. So I think that that's really, really great. This is really very, very fascinating topic. And I can think of a lot of people who are going to want to run right out and contact you about getting some stem cells or some exosomes or something like that. I mean, I'm, want some myself. I highly doubt, see, in Israel, things are very, very regulated. Not everybody who listens is from Israel. That's an English speaking podcast, but a lot of people who listen are in Israel. And things are pretty regulated here. I don't think that this is something, I don't know. I'll have to look around. Have you heard of anybody in Israel doing this?
Well, I know there's regenerative medicine research out of Israel. I've seen plenty of academic
Research.
work. So uh, I don't know if there's clinical accessibility or not.
All right, you might want to think of opening a satellite office over here. I think you could do really well. If the Ministry of Health over here would allow it, I don't know. They're pretty rigid here. So let me ask you, what does spirituality mean to you?
Well, I'm always grappling with that, but I try to tap into my own universe, my own self, and I hear a lot, I read a lot, I go to a lot of conventions, biohacking and anti-aging, and you know, we look at things such as the different frequencies our cells are tuned to, and quantum entanglement and things like that. And I think there's an energy within us, and the more we can tap into that and understand our purpose and why we're here and what we do for ourselves as a species and as a group, um, then we can find that connection with others and with the universe. And somewhere in there, I think, is spirituality, and many people come at it from different angles to get there.
That was great. Thank you very much for that.
Sure.
And where can people find you? What's the best places to find you?
So our brand is called Recelebrate because we're re-celebrating the renewal of cells, CEL. So CELL. So it's spelled RECELLEBRATE, and that's our website. It's our social media platforms. We're Facebook, LinkedIn, Instagram, TikTok, all those. So you can find us, and just our website, recelebrate.com.
Okay, perfect. I'm going to make sure we link all of those.
Yeah.
And I just want to thank you so much for coming on. I really appreciate it. I know you're a busy guy, but this was really fascinating.
It's my honor to be here. Thank you so much for having me.
Hello, everyone, and welcome back. I am so excited to have back as my guest today, Rabbi Peretz Segal. Rabbi Segal has over 25 years of experience as a Rebbe in yeshiva. He is currently the Rosh Kollel of Kollel Etz Pri, where he is helping young families to be able to go do shlichut or take up positions of leadership in Chutz La'aretz. He also runs an internship program, Academy of Life Training, where they bring in young people from Chutz La'aretz and teach them life skills through the lens of Torah and place them in internships. He also does corporate and business training, working with teams to make them hum, as well as one-to-one executive coaching. So, First of all, I'm so excited to have you back here. I'm sure you guys remember we've had Rabbi Segal a number of times, and he is always one of my favorite guests.
Thank you. It's great to be here. It's always great to be here.
Thank you so much. Whenever I have a topic that kind of, I know is like a difficult one that no one can figure out, I always know you're going to be like one of the best people for it. So I'm really excited to see what you've got for us with this topic of stem cell therapy.
Yeah. So, first of all, I found the podcast fascinating. And I suppose what struck me almost more than anything else is this idea that you can almost engineer your health through this crazy intervention of discovering these cells which are so regenerative, and make yourself a new person, essentially. In other words, I suppose that's the long-term wish. But even now, you're regenerating a new part of your body. And so that kind of, whoa, that's pretty freaky, but it's also, in a way, so exciting. If you can do that, the potential for curing disease in the future looks pretty bright. So that's kind of what struck me first. And then obviously it made me think about, through the spiritual lens, is this something which is great and wonderful, or is this something which is maybe crossing a line? And I suppose the first thought that came into my mind is, we do recognize that there's a higher spiritual force, and that the creator is that. He's the creator. He's made me into me. And therefore, perhaps we have to be a little bit more cautious with interfering with the human organism and not redesigning him at our own will, and kind of almost taking the reins away from the creator and usurping them for ourselves. And as I thought about it more, it actually occurred to me there's a dispute between Rashi and the Rambam. It's in the Gemara in Psachim, where there's this statement the Gemara makes, and it says that Chizkiyahu, the great king Chizkiyahu, he buried, he hid, he put away, he has gonez, which means he hid from the people, put into a storehouse where no one could access it, a book called the Sefer HaRefuot, the Book of Healings. And he did that, and he was praised by the sages. They said, that's a great thing to do. Now, the question is, well, what was this book, and what did it have inside of it? So Rashi says, it was pretty much a book which was it was a panacea. It gave the cures to every illness.
Wow.
And the reason why he hid the book was because people having a cure to every disease would undermine the potential growth in their spiritual world. Nothing could ever go wrong. They'd have complete and total control over themselves, and therefore there'd be nothing to push them, no sense of vulnerability. They would have no sense of fragility, and therefore why would they ever need to look inwards, to introspect? They would just, if there's a problem, well, I'll just go to the book, fix it, and I'll be okay. And therefore he was very concerned about that, and he hid the book. That's what Rashi says. The Rambam differs, and the Rambam differs quite strongly, in fact. He says, I mean, he doesn't explicitly mention Rashi, but he says, those people that say that there was a book which offered cures and was hidden, that is antithetical to our entire approach to the world of medicine and healing. And he brings a few rationales, but one of the things he says, if it was made and put into the world, the implication is the Creator meant for us to use it. And just like he's given us the wherewithal, the intelligence, the capacity to involve ourselves in every aspect of the physical world, and when we're in the physical world, we play by its rules. In other words, there's actually an implicit spiritual underpinning to the fact that the world is guided by a system of cause and effect. And because our brains are programmed to both extrapolate and function within that cause and effect, that's the intention of the Creator. He wants us to use our brains. You know, like I think Galileo said, I can't believe that the God that made me with his mind then told me not to use it. So as a result, you know, he says, no, of course, if there's a cure out there, use any cure you can. And really what this book, the Sefer Refuot, was, it had nothing to do with medical cures. It was cures which were based on idolatrous practices. And there was a concern that it was originally written in order that people should know them to stay away from them, but there was the fear that it would be actually abused, and therefore it was hidden by Chizkiyahu. So that's kind of the paradox. And to be honest, I see both sides. Right. On the one hand, you know, you can see that there's something extremely dangerous about people, the human, becoming too powerful over their own fate. It can breed a certain kind of arrogance and intolerance and self-absorption, which is actually quite terrifying. But on the other hand, I once heard a joke, and the person said he'd only ever employ a one-handed economist, because the danger of economists is they'll present an argument and say, but on the other hand, so I thought it could be said true of a rabbi. On the one hand, there's this idea that we don't want to fall into the depths of being humanly debased because we become totally self-absorbed because we feel that we're all powerful. But on the other hand, if we have an instrument that's going to help us, some kind of a way of getting better, and we don't use it, well, then aren't we just being foolish?
Yeah, I would say so. I would say so, but I do hear both sides. Exactly what you're saying. But also, I feel like there's so many other things to life beyond the way we feel. And I feel like when people are in pain, I think it might be very hard to connect, right? Like if somebody's in pain all the time, then are you able to fully connect when you're davening? Do you know what I'm saying? So having this ability to decrease pain, it doesn't mean that it's solving like every problem in your life. It's just solving this one that will maybe help you connect, I guess, in other ways.
100%. And I think kind of for me, the way to reconcile it is it's like with many things in life that when you get your intention right, and I think that's where humility plays such a part. And like you're saying, that when you get your intention right, and I suppose you speaking it from the perspective of a healer and you feel that pain and you see that pain, and that's like kind of your daily exposure. So you don't want people to suffer unnecessarily. Like, it would seem like it's almost wrong to withhold from people something which can really be beneficial, and I completely and totally relate to that. And I mean, that's actually one of the Rambam's arguments. I suppose the Rambam was also a doctor, so he also felt that on a very experiential level. So I think, in terms of reconciling those two, I think, let's borrow from Rashi the humility that we need when engaging with the complexity of a universe that we know so little about, and the structure that we are very small, but at the same time, if there's something out there that's been developed and that we can use for our own, for our own maintenance of health. And as you said, that's exactly what the Rambam says. He says, well, how can you do any good spiritual growth if you're feeling like you're in pain and you want to go to bed? So yeah, 100%.
Yeah, wow. No, I think it's really good. And I think that this whole issue of stem cell itself is just such an interesting topic. And, it can't be done everywhere. Like, I don't think you could even get it done in Israel if you wanted to have it done in Israel. Right. And if we think about how many injuries that are from the war and things like that, where so many people probably could benefit from stem cells. And I don't think it's something they're using here. And it's a shame, I think. I don't know. Yeah. But then again, it's that whole question, I guess, of where are they getting the stem cells? Like,
right. So I suppose that's where the ethical issues come, like whose stem cells are we using? And, but I suppose, I mean, it doesn't seem like, I know that when one of our children were born, we had to fill out a whole long questionnaire to allow them to keep the stem cells.
Oh, did you allow that? Or did they keep them for you guys? Did you store them for you?
I mean, to be honest, I have no idea.
Oh, okay.
I just remember filling out the form. I had no idea what stem cells were, and I thought, okay, well, it sounds like it's something good. So, but and the only reason I probably got away with it is because my wife wasn't feeling that great at that point in time. But
right. Because I know in America, to keep the stem cells, you had to actually pay like a very high storage fee. I know when like my last two kids were born in America, I think we could have done something like saving the stem cells, but like to store them was like really expensive. And you were paying like all this money to store them. You didn't know if you'd need them. I wonder if they do take it for other things. I don't even know. I don't know. Yeah. So, okay, well, this was great. Thank you so much. I really appreciate it.
It was, as always, great to be with you. Really, really, very, very, I mean, I love your podcast. I think it's fantastic. It's enlightening and it always gives like a different angle on things and really is mind-opening. So I'm very excited, to keep on listening, and thank you for offering such a very precious service to the community.
This podcast is for informational purposes only. Please seek guidance from a trusted healthcare professional. By listening to this podcast, you release Holy Health and any of our guests from all liability. I'd like to thank Joker Productions for editing this podcast.